Hello, everyone. My name is Shellyza Sajwani. The topic for today's webinar is climate change and vector-borne neglected tropical diseases, positioning pharmacy practice to drive awareness, prevention, and management. If you can go to the next slide, please. So my background is that I am a pharmacist specialized in climate change, global health, and oncology pharmacy. I currently serve as the co-chair of the Canadian Association of Pharmacy for the Environment and work one day a week at the Ottawa Hospital, and also serve on the board of directors of Pharmacists Without Borders Canada. I currently also volunteer as the FIP Lead for DG21. FIP has several development goals, and the development goal 21 is sustainability in pharmacy. If you'd like to know more, you can search up the policy that we recently published in September 2023 on the topic of planetary health and climate change in pharmacy, and we will have a QR code for that as well. Next slide, please. So today we're joined by a panel of fabulous speakers, and I sincerely wanted to thank each of them for taking the time to prepare each of their presentations, and also wanted to thank the efforts of the FIP staff who have been very involved behind the scenes as well. So with regards to the next slide, as you can see from the slide, we have some announcements. So please note that this event will be recorded and live streamed on FIP YouTube, and the recording will be available at events.fip.org. To all those listening, please feel free to send your questions through the question and answer box provided, and I'll do my best to manage these questions so that at the end, we'll be able to address these questions. You're also welcome to provide feedback to webinars@fip.org. And at this time, I would also like to take the opportunity to promote the benefits of membership with FIP, including events and webinars. FIP is the global body representing 4 million pharmacists and pharmaceutical scientists. So if you are a pharmacist, if you're a pharmacy professional, or if you're a pharmaceutical scientist and you would like to become a member, please register on FIP's website at fip.org. So with regards to today's program, I have a few slides to present just on sustainability, and then we will also have a few presentations specifically on the topic. So the first will be the recent changes in global burden and distribution of vector-borne NTDs. So the impact on affected populations and healthcare systems, and that's by Chima Amadi. The second will be collaborative NTD management. How can pharmacists contribute? And that is by Emanuela Nizerbi. And then the third is the role of pharmacists in improving awareness about NTD prevention and treatment, and that's by Cristina Fernandez Berantes. Sorry about if I've mispronounced any of these names. We will then have a discussion and question and answer, and we will also have a wrap-up and conclusion. So next slide, please. So I just wanted to quickly provide an overview with regards to planetary health and pharmacy, and typically we think of climate change as part of that. So with regards to climate change, with the role of pharmacy professionals specifically, you can see a QR code here, which links directly to the policy that was created, and we have recommendations for hospital pharmacists, community pharmacists, public health pharmacists, those involved in humanitarian work, pharmaceutical scientists, and academics as well. So you can see within climate mitigation, what we tend to focus on is clinically appropriate deprescribing, and we also tend to look at reviews of metered dose inhalers, especially since the meter dose inhaler emissions are a lot more than the dry powder inhaler emissions. So considering sweat switches when clinically appropriate. The next one is anesthetic gas reviews. So desflurane specifically has a very high emissions burden. And so we typically look at reduction and elimination of desflurane. The third, as I mentioned, clinically appropriate deprescribing, especially in areas where, let's say patients were on particular medications and now the status of the patient has changed, and now you are looking, and now those medications are no longer appropriate, trying to reduce polypharmacy. And then finally, also thinking about supply chain review with regards to looking at green chemistry, renewable energy, and packaging as well. And there are various institutions that have done some work specifically with supply chain. Next slide, please. With pharmaceutical pollution, typically, again, we think about, so pharmaceutical pollution relates to climate change, but is also has broader impacts with regards to ecological toxicity. And often this really relates very closely with wastewater treatment. So one can be involved with trying to advocate for proper wastewater treatment. There's also work that can be done with regards to single-use plastic reduction within the pharmacy and within pharmaceutical industry. And then finally, research that can be done on general ecological toxicity, toxicity of pharmaceuticals in the wastewater causing issues like antimicrobial stewardship, a whole host of issues that can occur, and then looking at research with regards to solutions and focusing in on education there as well. Next slide, please. So with regards to climate adaptation, so typically when we think about certain countries have a higher emissions burden, and certain countries, all countries have an emissions burden, but certain countries have more than others. And similarly, all countries are vulnerable to climate change, and all communities are vulnerable to climate change, but there are some that are more than others. So with regards to climate adaptation, within pharmacy, we often think about disaster plan management, emergency readiness, and then we think about clinical aspects to medication management as well. So for example, thinking about how do you look at lithium and diuretics in heat wave when you know that there can be toxicities as well. Looking at how medications are stable under the presence of heat as well. And then finally, a big area of climate adaptation, which we will focus on today, is really just learning about the clinical impacts to health. So thinking about how can climate change affect cardiology, affect in oncology, and of course, affect infectious diseases. And how this helps us is that it basically helps us be prepared and also understand what are the implications specifically to pharmacy services as these health trends continue to change. So again, I put the QR code there, and that will help with regards to learning more about the policy. And if you have any questions, and if you are interested in the FIP sustainability strategy, please definitely contact us as well. Next slide, please. Okay, so with regards to the climate change impact on health, this is a great picture that you can, this is a great slide you can take a picture of, and you can see all of the different impacts with regards to health, specifically on cardiovascular disease, on mental health, on respiratory disease. And here you can see I've circled the area with regards to infectious diseases that is also sometimes related to vector ecology as well. Next slide. So the organizations working in this area, there's a lot of work that's happening with various organizations and small groups, volunteer-based groups too. So RX for Climate is a volunteer-based group of expert climate change specialized pharmacy professionals, which basically helps to consult on various initiatives. I'm the co-chair of the Canadian Association of Pharmacy for the Environment, which we built, which was just founded in April 2022 to try to advocate for changes specifically for Canada. Pharmacy Declares is a similar organization in the UK. And then Climaceutics Health Solutions is a group that focuses on reducing emissions and helping climate adaptation of community pharmacies. With FIP, they have their own sustainability strategy, which is, also has led to the creation of this new policy that has come out. And there are also other health-specific organizations. So if you're a little bit worried about, how do you create an organization in your own country, you can also look at what is being done with health more broadly, and then join and provide your expertise as a pharmacist as well. There are also consultancy organizations that provide some really good recommendation with regards to carbon footprinting and renewable energy, which is really important for big buildings and community pharmacies, hospital pharmacies, and really anywhere where we're in a building. So trying to broker relationships with these organizations is really useful too. Next slide. So with regards to today's learning objectives, attendees will learn about the recent changes in the global burden of neglected tropical diseases and the impact of climate change in the distribution of disease vectors. The number 2 is collaborative approaches between pharmacists and other healthcare providers and policymakers to fight against NTDs. And then the third is there are opportunities for pharmacists to actively engage in community education and awareness programs, as well as NTD prevention and management. Next slide, please. So our first speaker is someone I know very well. He also served as the co-chair of the policy committee that created FIP's first ever policy on climate change as well. So this is Chima Amadi. So Chima Amadi is a pharmacist and public health professional with many years of experience in the Nigerian and the United Kingdom health sector. He is the FIP Global co-lead on sustainability and pharmacy, where he co-chaired an FIP committee that developed FIP's policy statement, most recently on environmental sustainability within pharmacy. So without further ado, I'd like to introduce Chima Amadi.
Thank you so much, Shellyza, and thank you so much to FIP for the opportunity to share with us today about the topic we are looking forward to, and about the recent changes in global burden and how distribution of vector-borne the neglected tropical diseases and how its impacts on populations and healthcare systems. So it's really nice to be here. So look forward to the discussion. Next slide, please. So I'll start with a quote. So this quote is taken from the WHO. So the WHO DG in one of these the WHO what's it called? WHO meetings, right? He mentioned that action against neglected tropical diseases is core to the vision of universal health coverage, and it contributes significantly to the achievement of sustainable development goals. So basically, it's trying to let us know that when we talk about NTDs, that is neglected tropical diseases, that if you don't really act on it, then we cannot really be having serious conversations about achieving universal health coverage in line with the UN SDG 3. So it's really good that we're having this conversation on World Neglected Tropical Disease Day. Next slide, please. So for those who are not really so familiar about what neglected tropical diseases are, so they are a diverse group of zoonotic transmitted conditions, more like animal transmitted. So animal-like is the mode of transmission. So it's more of animal transmitted or human transmitted, as the case might be. And they are mainly prevalent in tropical areas. So tropical areas where you have like a more high temperatures, areas susceptible to high temperatures, like in Africa, some parts of South America, and some parts of Asia as well. So they mostly thrive amongst impoverished communities. So there's always this direct relationship between neglected tropical diseases and poor communities, more like communities whereby their financial status is quite low. So there's this relationship amongst them. So it's not really caused by one particular pathogen. So it caused across different pathogens, which includes your virus, bacteria, parasites, fungi, and toxins. So if you look at the image at the right hand side, so you see different types of causative, some vectors or some vector carrying can causes neglected tropical diseases. You have like your intestinal worms, you have like onchocerciasis, lymphatic filariasis, which is also caused by the mosquito-borne disease. And yeah, so it's quite broad in terms of the different pathogens that causes them. So clearly, it's associated with devastating health. So it's not just somebody feeling unwell. So it's also associated with social and economic consequences. So, for example, in impoverished communities where you have high prevalence of neglected tropical diseases, so it also have that impact on their socio-economic well-being as well. So it has like, so it kind of impacts the wider determinants of health of any individual. So it's estimated to affect more than 1 billion people globally. So currently, we have up to like 8 billion people globally. So any disease that affects up to 1 billion must be very, very serious. And of course, it cuts across different geographical backgrounds as well. And so amongst those who are infected, NTDs intervention, who need NTD interventions, more like people who have been diagnosed with NTD related infections. So you have like estimate of 1.6 billion globally. Next slide, please. So I don't know, these maps are a little bit faint, but if you can see this map here, so the map, the one at the bottom right. So this is like the prevalence of NTDs in the 2010. So you see that 1 billion people are affected. So as at 2010, so I just want to point out how NTDs have actually spread over the years. So as at 2010, you can see like the areas that are white, more like where you have the United States, Canada, and some parts of Russia. Those places are white. So what it actually means, there are some parts of South America as well. What that actually means there is that so the prevalence of neglected tropical disease we are almost insignificant in 2010 in those areas. And then as you can see in the map at the upper right corner, you can see that those areas are a little bit faint. So there are actually traces of NTDs in those regions. So clearly what this shows is that areas that hasn't really been that are not endemic to NTDs previously have now been recording cases of neglected tropical diseases. And again, as you can see, in 2010, so back to the graph or the map at the bottom right corner, it says we have approximately 1 billion people affected. That's as at 2010. And you can see the first bullet point here, which says that, that we have at 2022. So Southeast Asia has the highest number of people, whereby that is having these NTDs, 857 million, more 51.8%. So actually, you can see that there has been significant increase in NTDs prevalence globally than what it used to be before, like in the past 10 to 20 years ago. Then, of course, so Southeast Asia have high rates of it, and they're followed by Africa, where you have 584 million. So Africa contributes 35.3% of the prevalence of NTDs. And then, so the remaining 4 regions actually account for 212 million total people requiring interventions, or 12.9% of the global total. So these remaining 4 regions, mind you, are more of like the wind places where you have like the not so humid regions, the temperate regions, like you talk about, like the Europe, the Americas, in case of Russia and all. So now there are significant cases in those areas. And usually, one striking thing about neglected tropical diseases is that usually they don't always take the center stage when we are talking about global health agenda. So until of recent, whereby both the WHO and other agencies like the Global Fund and all are now taking it quite serious, because we actually now know I cannot really actualize universal health coverage if you don't take care of these neglected tropical diseases. Next slide, please. So in my previous slide, I mentioned how areas that are not prevalent to not neglected tropical diseases before are now prevalent based on the changes in pattern. So one of the key factors that are responsible for this is climate change. I'm very happy that my colleague Shellyza have mentioned some of the key things in her opening slides. So just to kind of add to what she has already said, so the NTDs expansion into previously non-endemic areas can be attributable to climate change. So one significant area of this is changing rainfall pattern. I'm sure all of us here can kind of attest to the fact that the pattern of rainfall, as we all know it as had before in our regions or wherever we might come from, has actually changed. Both when you timing for snow, when tight snows falls, or when you have the rainfall and the harmattan. So there have been this kind of disruption in rainfall. And due to this disruption has caused displacement of people and animals. Remember, as I mentioned earlier, NTDs is related, has direct proportion with socioeconomic well-being of people. So the more people are socially displaced, the more chances of them having NTDs prevalence. So, and due to this rainfall pattern as well, so there's also changes in NTD spreading insect population. So the vectors of these infections kind of change as well. So they tend to migrate in areas whereby they can obtain their optimum water supply, or areas where they have like the more temperate or weather conditions that suits them. So there's migration of these vectors, thereby ensuring that the spread of NTDs are in those places where they are not naturally endemic. Now, because of this spread, clearly there will be increased vector infection by the pathogen. So due to this spread of vector-carrying organisms, so there will be high spread of infections in different pathogens and in different organisms across the globe. Now, another area of impact of climate change, you talk about high temperatures and heat waves. Clearly, even in the UK here, or even in some parts of Canada, I'm sure the temperature increase has been quite enormous. You have heat waves across board in Australia, across board. It's very, very significant, unlike what we used to have a few years ago. So what this happens is that it leads to shorter life cycle of the pathogens. So clearly, for example, a pathogen that normally takes, say, 5 weeks, for example, to get from the egg to the maturity phase, kind of gets shorter, kind of maybe becomes like from 12 weeks, you have like 2 weeks or 5 weeks, as the case might be, due to the heat wave, because they thrive in such conditions. So what it means is that the reproductive cycle and the number of these vector-carrying organisms will be much more increased compared to what they used to be, and also have more rapid reproduction rates. So clearly, the vectors will have like a better breeding ground for them to thrive and kind of lay more eggs, and which will now lead to more vector-carrying organisms happening. And then increase vector feeding rate. So they also feed more, and also increase their invasion of the vector host. So these two key areas are where climate change kind of impacts neglected tropical diseases. Next slide, please. So some of the risk factors here of NTDs. So we've mentioned poverty and disadvantage, more of the socioeconomic factors, and whereby people in poorest populations, often living in remote rural areas and in urban slums or in conflict zones, like we have in war-torn zones as well. Genetic and biological factors as well might be one of the key factors. Physical and environmental factors. So this one is basically key because I mentioned issue of climate change as well, and I mentioned the issue of housing, where people live, where they reside, and how the environment. So depending on the kind of environment they live. For example, the mosquitoes that are responsible for some of these neglected tropical diseases. So people who live in waterlogged, stagnant areas or polluted areas, where you have like water pollution, are more predisposed to being faced with neglected tropical disease. Again, it still boils down to climate change. So social and political factors is very, very important to note here as well, because in areas where you have political instability, people tend to move, people tend to be displaced, And when that happens, they are also at risk of neglected tropical diseases. Then economic factors is also a key factor there, because again, since it's a disease of poverty, so if some people who are at the bottom of the financial ladder, who are classified as poor based on the World Bank benchmark, clearly people in such regions are predisposed to having prevalence of neglected tropical diseases. Next slide, please. So impact on affected populations. So we've talked about the prevalence and the factors that drive them. So look at how this affects different populations. So you have one of them, which is stigma and exclusion. So for women who and young girls who are affected by these ailments, they tend to be stigmatized, especially in societies whereby they have like very big in ethnic and cultural beliefs. So these women tend to be stigmatized and excluded from the community. So it prevents inclusion in communities, especially when it comes to women. So it leads to high prevalence of anemia in pregnant women. So of course, when pregnant women have high cases of anemia, clearly it will also kind of lead to prevent their unborn babies to develop properly and kind of affect the development of the babies in their wombs. It increased incidence of sexual dysfunction, increased risk of sexually transmitted infections. So RTI, STI, sexually transmitted infections, and neglected tropical diseases are also directly proportional. So people who have high rates of neglected tropical diseases tends to be more predisposed to also having sexually transmitted infections as well. So clearly, if you tackle neglected tropical diseases, you also end up tackling sexual transmitted infections and reduce their prevalence as well. So for children, it causes damage to children's health and development. So right from the womb, when children are still like in the fetal stage in the womb, until when they are born. So it retards child development and can also cause child mortality as well. Next slide, please. So impact on health systems. So this is very, very important because during COVID, we saw how COVID actually impacted our healthcare systems. So it fragments our healthcare system. So we are making the approach of, countries are signing the pandemic accord, whereby we have like share information across board, not just within the countries, but across countries, across regions, in terms of pandemic preparedness and kind of getting ready for future outbreaks. So neglected tropical diseases doesn't inhibit this integrative system. So it fragments healthcare system, whereby it takes away the focus from the actual, say for example, the chronic ailments like diabetes and all hypertension, and kind of isolates only the government or the healthcare system trying to fight disease outbreaks, not knowing there are so much correlations between these two. So it encourages fragmentation of healthcare systems. Weak integration of healthcare systems as well. So, for example, in South Africa, there has been what the South African government has done in terms of incorporating community-led healthcare services into the mainstream healthcare services, more of integrative care. So, but with high rates of neglected tropical diseases, so it kind of impedes this integration process. It isolates it and kind of makes people who are more susceptible, people in those susceptible regions, to have this prevalence and isolate them from the actual healthcare service that they might require on having that whole systems approach for healthcare systems. Burnout of healthcare professionals. So this one is very, very important. The WHO have been saying so much about this. So when you have high rate of neglected tropical diseases, so you are shifting the focus of healthcare professionals who are supposed to, manage the day-to-day prescriptions of people and provide for their well-being prescriptions and kind of ensuring that the healthcare of the populace holistically is taken care of. So the attention is being shifted towards handling those neglected tropical diseases prevalence in those areas. And again, of course, through this means they might also get infected. And when you have high rates of health professionals getting infected, what it means, you're also reducing the patient to health professional ratio during that time, and that can be very catastrophic and impact the overall health well-being of the country or the area or the region, as the case might be. catastrophic payment for medicines. So we've talked about a lot about out of pocket payments for medicines, especially in areas where they don't have universal health coverage, like most places in Africa and some parts of Asia as well. So with this high rate of neglected tropical disease prevalence, so people tend to spend more of their income on medications, and thereby even people who are very poor, they tend up, kind of worsening the rate of poverty among these people, because they tend to spend most of their money taking care of themselves, because again, the healthcare system has been weakened by the disease prevalence. So they tend to spend more on medications, and that can have the severe impact on the family and on the community or society, as the case might be. So I've mentioned what the isolation causes to different areas where this prevalence is high. So due to this isolation, it widens the inequality gap. We're talking about how COVID has also widened the health inequality gap between the wealthy and those who are at the bottom of the socioeconomic ladder. So it widens the gap further when this happens, because they tend to isolate them more, like they are on their own, in quotes, and then widen this gap, and thereby ensuring that health outcomes are not uniformly distributed, whereby some parts of the society gets better health outcome compared to others. So overall, it leads to poor health outcomes for everyone, because like WHO used to say, that no one is healthy until everybody is healthy. So clearly, if some particular groups of the population, like those in the financial bottom of the financial ladder, are not healthy, or those who are prevalent with neglected tropical disease are not healthy, clearly the overall population will not be healthy, because we'll also be at risk of either being infected or our health deteriorating in one way or the other, due to these relationships between across these diseases and these driving factors. Next slide, please. So the WHO have actually developed an approach to tackle neglected tropical diseases. So the title of the blueprint, or the white paper they've developed, is called "Ending the Neglect to Attain Sustainable Development Goal: A Roadmap for Neglected Tropical Diseases 2021 to 2030." So it's aiming it has tied it to Sustainable Development Goal 3, knowing how important it is to tackle neglected tropical diseases to achieve Sustainable Development Goal. So this document is online. You can find it online too and take a read as well. But basically, it kind of gives the various approach to it. It focuses on using innovation and intensify disease management process in terms of people who are already infected, ensuring that those people have access to adequate healthcare and appropriate disease management process. Preventive chemotherapy, so people who are susceptible but they've not been infected yet. So kind of using that approach and promoting preventive chemotherapy, so that they'll be equipped and reduce the chances of them getting infected. Vector control is also another way that they've mentioned, in terms of taking care of the pathogens or the vectors that cause these ailments. So it's also aimed at promoting veterinary public health. So clearly, there's always this disjointment between public health and veterinary public health. So creating kind of an integrated approach, whereby the veterinary public health kind of aligns with the human public health, and not thrive in isolation. Through this collaborative means, can be able to have like a holistic approach to tackle neglected tropical diseases. Now, another one is WASH. That is, we're talking about water, sanitation, and hygiene. Which is very important, because we mentioned about stagnant waters as breeding ground for these vectors, sanitation, and hygiene. So promoting and providing safe water, sanitation, and hygiene, and encouraging these aspects in terms of for people in rural communities or urban slums to take their hygiene seriously and drink safe water as well. More like day-to-day healthy practices will also prevent the challenge of neglected tropical disease prevalence. Next slide, please. So overall, ways to control and prevent NTDs. First one is for health ministries to combine climate and health data to support better health decision making. So again, health ministries are encouraged to not just make decisions based on the health data they have, but to also look at what the climate implications are, So because when you combine what the climate implications are with the health data you have, you end up making better healthcare decisions and make better policies that will tackle not just the actual disease itself, but the root causes of the disease. So it's need for the governments to prioritize economic growth because we've mentioned about people at the bottom of the economic ladder. So clearly, when the economy is doing well, you pull people out of poverty, and when they are pulled out of poverty, you are reducing the chances of them being infected with neglected tropical disease. Then address the social determinants of health. We mentioned like housing, people living in slums, and then reduce inequities. I've mentioned about widening economic gap, kind of bridging those gaps, both in terms of access to healthcare, in terms of access to public health campaigns, in terms of education, in terms of making sure that people are more conversant and have ways to protect themselves against these diseases, and tackle systemic racism as well in terms of discriminations against where people come from and where the regions that they come from as well. It's very important. It's also important to tackle climate crisis so that the urgency is real. I'm happy what the impact in COP28, and now we're looking forward to COP29. So it's very important for governments, not just at the national level, but at local level, to take climate change very, very important. Let's strengthen community-oriented primary health care. So similar to what I mentioned earlier, like what the South African government is doing. Look at how we can strengthen primary healthcare as the basic foundation of providing healthcare to the people, bringing healthcare closer to the people, and involving communities in this approach as well. Then integrating healthcare systems. So ensuring that healthcare systems don't thrive in isolation, that they thrive together and to tackle this particular challenge. Next slide, please. So I know many of us on this call are pharmacists, so we'll be asking ourselves, what role should we play in tackling neglected tropical diseases in our area of work? So, like my colleague Shellyza mentioned earlier, so FIP have developed a policy statement on environmental sustainability within pharmacy. So, also share this. So, this is how the image by your right. That's how the statement looks like. So that's the front page. So if you can use the QR code or go online, you'll see the statement. It provides how roles that each pharmacist, irrespective of your area of practice, can play in terms of promoting climate change. So having said that, public health surveillance is very key. So it's very, very important for us as pharmacists, especially those in community pharmacy, to keep and to take part in surveillance, not just counseling, take part in surveillance in terms of understanding how these patterns of neglected tropical diseases, in case when the disease prevalence happens in our areas or in our area of practice, we can detect it and survey it properly. Education and awareness campaign. It's also important for us as pharmacists to counsel our patients about this disease because many of them don't know about it. Counsel them and advise them during the course of our prescription refills and all, and let them know about the importance of these diseases. Now, improve access to medications against NTD. So you have to take supply chain seriously in terms of ensuring that people who need these medications, who have been diagnosed of neglected tropical disease, have access to their medications as at when due. Also advocate for pharmaceutical manufacturing of these medications so that the people who need them can have them as at when due. Next slide, please. Thank you very much for listening. I look forward to your questions. Thank you very much. Back to you, Shellyza. Thank you.
Thank you very much, Chima. So I'm reviewing the chat box and the Q&A area. If you can put your questions in the question and answer box. For now, however, we will now go to our next presenter. Thank you very much, Chima, for this great presentation. So our next presenter is Emanuela Nzerbe, who is a licensed pharmacist in both Nigeria and Ghana. She is a researcher at the National Institute of Pharmaceutical Research and Development in Nigeria, and she also served as the chairperson for public relations in 2023 and is now the 2024 president-elect of FIP ECPG. So without further ado, Emanuela.
Hello, everyone. Good morning, good afternoon, good evening. Thank you so much, Shellyza, and thank you, FIP, for giving me this opportunity to talk extensively on the role pharmacists play and how we can, put together, have a collaborative effort towards tackling NTDs. So we have some really big questions that I feel we need to ask ourselves as pharmacists. And the first one is whether we are aware of NTDs, what they are. And as the first speaker already mentioned a whole lot and gave extensive explanation about what NTDs are. So I believe this alone is bringing us up to the understanding of what NTDs are, how deep they are, and in between that, you can see that there are some things that you and I can do as pharmacists. And then the next question is, what are the ways of prevention? Already part of it has been spoken by the first speaker. And then the next question is, how can pharmacists contribute and collaborate with other professionals to make sure that we tackle NTDs? Next slide, please. And before anything, I would like to reemphasize the fact that these neglected tropical diseases are very preventable. And they are very preventable diseases, and it's high time we start discussing how we can prevent these diseases other than focusing on the treatment. There is this popular thing about that is being said that prevention is better than cure. So it's being said where I come from. So prevention is always better than treatment. When we prevent certain diseases from coming, it's always better in terms of economic wise than treating it. So usually clean water, sanitary food handling, good hygiene are simple ways of preventing these diseases, especially the soil transmitted helminthiasis, you have the trachoma, the schistosomiasis. Those are the easiest ways. And of course, for the vector-borne NTDs, one major thing is to prevent the spread of these worms, the flies, the mosquitoes, and other hosts. So if there's a way this can be prevented, the vector control, if there's a way this can be done, definitely we are on our way to prevent these neglected tropical diseases. Next slide, please. So I would like to say the very first thing, which is the first step, education and awareness. Education and awareness. And I mentioned here the first that the pharmacy curriculum, most often than not, they talk about NTDs is not mentioned, is not always part of our curriculum as pharmacists. So the question is, how do we get to know about them? For myself, I can only say that I got to know more about NTDs, not from the four walls of the classroom, but outside in my engagement. And I believe that this will be the same for some of us. So our curriculum needs to also, there is a need for discussions around NTDs to be mentioned. And needless I forget that when we talk about neglected tropical diseases, we can't achieve universal health coverage without tackling neglected tropical diseases. So this is one of the reasons why these should be part of what is being discussed even in the classroom and not just the outside world. So which is one of the reasons why I mentioned that the very first question is, are pharmacists aware about neglected tropical diseases? Then the next one, after being aware of it and knowing, which I believe this webinar is all about, knowing more about neglected tropical diseases, the next one is promotion. There is a need to educate the high-risk population through outreaches, health campaigns, as you can see in the picture. Next slide, please. Then the role of pharmacists in NTD prevention. As custodians of medicines, which I mentioned here, it is when it comes to collaborative management, the first discussion is medication management, because we are the custodians of medicines, and when it comes to the medicines, medications aspect of it, the rest of the healthcare professionals leave that aspect to us. So we talk about the availability of these medications. Are they, how available are they? Then medication dispensing. Once the medications are made available, the next thing is dispensing them and then patient counseling. So there are a lot of preventive medications that are being given, which is part of the chemotherapy that was mentioned as part of the strategies that WHO came up with. So definitely, with these are the very necessary things that have to be mentioned as pharmacists, and this is where we also play our own role. Next slide, please. And then, of course, when another thing is surveillance and monitoring. So when these medicines are even dispersed or given, the next thing that we should be talking about is how do we monitor drug resistance? Because some of these medicines that are used even for prevention and chemotherapy, they can easily come. Some of them are antibiotics, and they can easily cause drug resistance. So under the surveillance and monitoring, we should be talking about monitoring for adverse events and even reporting those adverse events. And then as part of the promotion or the public health initiatives, there is a need for us to actively participate in the vaccination programs, because we know that vaccination is one important aspect when it comes to NTDs. So we have to actively be involved in vaccination and even controlling disease vectors as well, which I mentioned earlier. Next slide, please. And then these are the major areas where I feel like we need to talk about collaboration. First off is the drug research. I know that, like I mentioned earlier, that drug is, when it comes to medications, we are the custodians. There is also the need, because one of the major reasons why tropical diseases are called neglected is simply because they do not have, they do not get those attention compared to other disease conditions. So this simply means that there is a need for further research and drug discovery to be able to come up with preventive medications and also treatment medications. So in the areas where we can collaborate as pharmacists is under the drug research, policy and advocacy, collaboration with NTD networks. There are a lot of NTD networks that are there, and for one of them is the Youth Combating NTDs. We have Uniting to Combat NTDs, and then Neglected Diseases Network. There are a lot of them. So some of these NTD networks, we can join them or collaborate, continue to have this conversation. Then the next one is join the discussion. These discussions, join the discussion, continue to have the discussion. And as mentioned earlier, we, FIP already has the paper that is talking about sustainability from the pharmacy point of perspective. So this is one of the things that we need to focus on. Joining the discussion would help us go a long way to collaborate with other healthcare professionals so that we can tackle NTDs. Next slide. So that will be all from my side. And because I'm here, I like the fact that I'm here also representing the early career pharmaceutical group. So this is just a simple call for the early career pharmaceutical group members that are interested in attending the Congress. So we have the students, the ECPG IPSF or students on the early career pharmacist package. There is an info session that will be coming up this Saturday, and then the package has a lot of discounted prices that would enable we, the young pharmacists and students, to be able to attend the Congress. Thank you very much once again for this opportunity. Over to you, Shellyza.
Thank you so much, Emanuela, for that amazing presentation. So our next presenter is Cristina Fernandez Barrantes. She is a hospital pharmacist from San Jose, Costa Rica. She currently works in the Drug Information Center and Antimicrobial Stewardship Program of San Juan de Dios Hospital. She also has a master's degree in clinical pharmacology from the Autonomous University of Barcelona and is a PhD candidate in pharmacology from this university. Her study and interests are within infectious diseases, pharmacovigilance, drug interactions, and patient education. And without further ado, please take it away, Cristina.
Thank you very much for this introduction. And on behalf of the Pharmaceutical Forum of the Americas, it is my pleasure to participate in this webinar about our experience on public health campaigns to prevent the impact of arboviruses in Latin America. Next slide, please. Today, we are going to be covering 3 sections. First, I'm going to give you an overview about the arboviruses situation in the Americas region. As a second point, some examples of actions that pharmacists can implement in their communities to minimize the impact of arboviruses. And at the end, I'm going to talk about public health campaigns led by the Pharmaceutical Forum of the Americas. Next. The main objective of this presentation is to describe the main activities carried out by the pharmacists in the Americas region and their contribution in the burden of neglected tropical disease like arboviruses infections as public health threats. And next slide. The term arbovirus refers to a group of viruses that are transmitted by hematophagous vectors to susceptible vertebrate hosts, generally wild animals. More than 500 viruses of this type are recognized, and more or less 150 can cause that disease in humans. Next. Data from the Pan American Health Organization shows that the region of the Americas during the year 2022, more than 3 million cases of arboviral disease were reported. Of those, 90% were dengue cases, 9% chikungunya, and 1% Zika cases. In this graphic, you can see that the introduction of chikungunya and Zika in our region. And through these 13 years, you can see that the most predominant circulating arbovirus was dengue. Next slide, please. It is believed that the reemergence of the vectors lies on the social, economic, and environmental factors which directly affect the evolution and adaptation mechanisms of these insects. Some of these factors are climate change, Basically, the increase in a global temperature to 1 to 2 Celsius degrees can increase the extension of the geographical areas where the insects can develop. Also, demographic growth and distribution. It is said that in next years, almost 80% of the total world population will be living in urban areas. So this is also another factor that can favor the mosquito growth. Deforestation and poor urbanization, lack of drinking water, which forces inhabitants to store water in badly covered containers, favor the emergence of potential breeding sites. Also, we have to mention migration and tourism as factors that favors the mosquito spread. And the greater speed at which the population currently travels, and it makes possible that millions of people cross borders every day, favors the circulation from the endemic areas of the virus to free disease areas, but where the vector lives. So there is, that's one of the main reasons of our emergence and reemergence of these diseases. Next slide, please. In this slide, you can see the geographical distribution of the main vector-borne disease in the region of the Americas. As you can see, dengue is present almost in all over Latin America, as well as chikungunya and Zika virus. Next slide, please. One of the educational resources developed by the Pharmaceutical Forum of the Americas is this pocket guide for community pharmacists. It is a summary of clinical characteristics and an update for pharmacists with the best, with evidence-based information about dengue, Zika, and chikungunya. This guide is available on the Pharmaceutical Forum of the Americas webpage and can be found in English language as well. Next slide. Now I'm going to talk about 3 actions that community pharmacists can implement in their pharmacies or even participate with local governments and multidisciplinary health teams. First, in the next slide, you can see like our first action is education. And when we talk about neglected tropical diseases, knowledge is power. Education should be the central strategy in the control and prevention of arbovirus infections. There are many scenarios where pharmacists can implement systematically education to people at risk or even to general population and of course to patients. Our second strategy in the next slide is patient approach. And patient approach is very important because we all know that if pharmacists are the most accessible healthcare professional in communities, and all patients with suspected with any arboviruses should be evaluated comprehensively. And in case of signs or severe forms of these diseases, patients should be referred to a medical doctor for its management. Some serious symptoms or attention to a special population, for example, children or pregnant women, generally require hospitalization and the management of advanced support therapy. That's the reason why we have these pocket guidelines for community pharmacists, so they can identify severe forms of the disease and it can advise the patients to go to an emergency room or medical doctor consultation. Next slide, please. And one of the most important strategy for the control of these diseases is vector control. The prevention or reduction of the transmission of arbovirosis depends entirely on mosquito control, and we look for interrupt the contact between the mosquito and humans. Mosquitoes uses a multiple big amount of small spaces, both artificial and natural breeding sites. With this scenario, the vector control should be directed to eliminate all possible breeding sites in communities. The best advice also we can give to our patients is to protect themselves and their families with clothing that reduces the amount of exposed skin at times of the day when the mosquitoes are more active, and protect them from vector bites. Also, the use of repellents on areas of exposed skin or in clothes are also a good alternative to protect from mosquito bites. Another advice is the use of mosquito nets with repellents to protect people when sleeping. And one of the strategies is chemical control. But in this case, chemical control should be reserved to health authorities that have trained personnel to manage and apply these chemicals. So it's not like a strategy that can be implemented in a community pharmacy, but it's a good idea or a great example to show our patients that chemical control can work for vector control. Next slide, please. And my last topic in this presentation is to talk about the experience of the Pharmaceutical Forum of the Americas in a public health campaign developed in years 2016 and 2017, launched on the context of the FIP World Congress in Buenos Aires, Argentina. In this Congress venue, as part of the scientific and commercial exhibition, a stand was placed with pharmacists from Argentina, offering information about this topic and also answering questions from the participants. The general goal of this campaign was to support the participation of pharmacists and their contribution to improve the healthcare systems and public health actions about dengue, chikungunya, and Zika in the region of the Americas. Next slide, please. The name of this campaign was Pharmacists United Against Dengue, Zika, and Chikungunya. And the most interesting thing about public health campaigns is that pharmacists can work directly with all age groups of people in the communities. I would like to show you two examples in this slide. The first one at left-hand side is the participation of pharmacists in a puppet show with children, where they explain how to prevent and control the vectors and also the main symptoms of the disease, so children can take this message to their parents and the rest of the family. At right-hand side, you can see that work was also done with groups at risk, giving information and identifying and eliminating possible mosquito breeding sites in the communities. And next slide, please. Also, educational infographics were developed all over Latin America, and many of them are still available on internet. Many governments and pharmaceutical societies have developed this topic, and you can use them as an inspiration to create your own ones, or you can use the ones that are available. Next slide, please. And finally, we arrived to the last stage of the campaign, and it was the development of technical documents about arbovirosis for professional consultation. They are available on Pharmaceutical Forum of the Americas webpage, where you can find the documents and resources in Spanish and English as well. And in the last couple of slides, I want to give you my conclusions about this topic. And first, I would like to say that vector-borne neglected tropical diseases are a set of infectious diseases that primarily affect the most vulnerable people. Arbovirus infections are a complex public health problem that requires multidisciplinary efforts from health professionals as well as local governments and citizens. The geographical location of Latin America, the commercial extension, tourism, and migrations, as well as the presence of the mosquitoes, highly adaptable as vectors, favors the emergence and reemergence of these diseases. Next. Pharmacists are the most accessible health professional in communities, and from this strategic position, pharmacists can actively participate in those public health campaigns, participating in detection, patient approach, and vector control. Public health campaigns are useful to inform these communities about neglected tropical diseases, but about how to prevent them. Thank you very much for your attention. And if you have any questions, you can ask them in the chat.
All right, thank you so much for our three presenters. What we will do now is you can use the question and answer tool to basically ask your questions, and we will do our best to try to answer some of these questions. For now, I've gathered a list of questions that were already asked in the question and answer box. If you asked your question in the main chat, if you can just copy it over to the question and answer box, which will be a little bit easier for us to track. The first question, there was a clutter of a cluster of questions with regards to what patients and public can do in their day-to-day life in order to reduce the amount of patients who have neglected tropical diseases in terms of prevention. And there was also a question on whether there are first steps that can be taken in health promotion with regards to education and health policy staff to help combat neglected tropical diseases. So I feel like this question is kind of relevant to all of you. But because, Christina, I feel like yours was the most kind of campaign focused and operational focused presentation, I'm wondering if you would be able to answer some of these questions.
The one about education, right?
Yes.
Okay.
Yeah. So, what can the public do, and what can we provide for health policy staff?
Okay, we consider that education are the most important strategy for patients and even for governments, because if they don't know the consequences of these diseases, they won't put attention of what is important or relevant, or what are the health consequences for our populations. So that's why we center our efforts first on education. People with knowledge about these diseases definitely will take more care about their health, and governments will see the impact of these diseases on more hospitalizations and people that cannot go to work or go to school because they are with severe forms of the disease. That's why we first center our strategies in public health campaigns. So information definitely is power in order to prevent neglected tropical diseases in our region.
Great. And what can patients do specifically, like the public in general, outside of people who are in this particular area? This is interesting for me too, because I'm not specifically in this particular specialty.
For example, I will give you the Costa Rica example. We live in an area where these three diseases are endemic. So we advise patients to use repellents, for example, all year long, even if it's rainy or not, because the vector is present all is always present. So patients, if they know that they are in an area that they have a lot of cases, or where there are possible many breeding sites, for example, rural areas where agriculture uses water, and sometimes there is a lot of places with stagnant water, we suggest them to use repellents in an afternoons, for example, where the mosquito is more active. Another strategy is to eliminate possible breeding sites. And when it starts to rain in rainy season, we can find many possible breeding sites. So to eliminate them every day in every house or every park or school and community. That's the main actions patients can do.
Great. And anything to add from the presenters? I see Emanuela had to jump out for a second, but Chima, anything to add there?
Yeah, for me, what the patients might do, I think it still boils down to wash. By wash, I mean like, safe water, hygiene and sanitation. So I think people in those tropical areas should be careful, like maintain their hygiene. That's like the basic anybody can do, right, in terms of preventing those things. And again, educating their neighbors. They should also help in the campaign as well, spreading the message, because there is a limit to what health professionals can do. So if we have like a community of patients talking to their whole fellow people who live around them and those kind of things, that also help to spread the word. And when they are more educated and are practicing wash, I think the chances of them getting those infections will actually reduce.
Great, thank you. Yeah, just from a global health perspective, with Pharmacists Without Borders and with other work that has happened, we have noticed that any kind of local initiatives that involve champions on the local level, or even on the on the village level, for example, tend to be much more successful, because you have those individuals who are coming up with strategy, who are being given a platform and given resources to be able to manage needs of their communities, and it also helps with regards to empowerment as well. So thank you for those answers. There is are there new types of diseases that climate change will cause? So I think this person was probably listening to Chima's presentation, for example, and then later Emanuela's presentation, and looking at the differences in incidence of diseases with climate change, and is wondering, are there new diseases, or is it more changes in prevalence and incidence of existing diseases? So I'm going to start with Chima for that one.
So yeah, I think it's a mixture of both. Yeah. So first of all, we've now established the fact that there is this trend of endemic diseases in areas where there are not usually are. But right now, yes, of course, there is always chances of increased incidence of diseases caused by climate. We might not necessarily have a full list of what are the emerging diseases. Of course, there are a list of emerging diseases actually, but we can also relate that to climate, because climate, like I said, a lot of issues, once those basic socioeconomic factors or impact of climate is not addressed, it will always lead to future disease outbreaks happening. Even the COVID that we had, which was what we've never had before, really, somehow it has ties with climate as well, because somehow people in certain areas couldn't actually have access to healthcare and all. So somehow climate has a hand in both emerging and spread of diseases across board, really. So it's a mixture of both, if you ask me.
Great. And anything to add, Christina?
Now, we bring the arbovirus example because in the last 10 years, we have seen the emergence of this virus that were in our region in the past. And it's definitely one of the factors of possible factors of this reemergence is the rise in the temperatures, 1 to 2 degrees, and this favors the mosquito presence in our region.
Great, thank you. The next question is, are there types of symptoms that we should be screening or looking out for with regards to neglected tropical diseases? I see Emanuela is just connecting to audio, so I'm not sure if she's able to hear or not. So that one I'm gonna put to Christina.
Well, with arboviruses that are an example of neglected tropical disease, the main symptom is fever, pain, headache, and they are very, very similar. That's the reason why pharmacists should take this long interview with patients so they can be sure that it's about an arboviruses, because the symptoms are very similar to flu or even COVID. So when an arboviruses is suspected, we tell patients go to visit a medical doctor. But the main symptoms are fever and headache and pain.
Great, thank you. There was a question about what specific actions FIP has done to help prevent neglected tropical diseases. So I'm actually newer with FIP. I joined as a volunteer related to climate change. However, I think Ruben saw this question, and Ruben is a staff for FIP. So based on my own experience with FIP, they really help provide a good platform for pharmacy professionals in different countries to come together and have provided a good platform with regards to toolkits and policy, for example, handbooks, basically tools that can help pharmacists in their own countries. And of course, educational presentations like this one. So there are a few that are listed in the chat here. Ruben has put them here. So the one is on a vector-borne disease handbook, a digital event on developing global pharmacist travel health services, an event on climate change, and its risk to respiratory health, the policy, again, on environmental sustainability. And I think in particular, the vector-borne disease handbook, I think would be particularly useful for this talk, as well as the statement of policy for the environment. There was an individual who basically asked, how is the pharmaceutical factor associated with climate change based on this conference topic? So this was basically relevant to my presentation. So with climate change, if you think about it, you can think about separations in two particular areas. One is what we're trying to do is we're trying to reduce the emissions, because we know the emissions cause worsened health. And the second is we are trying to protect health and protect pharmacy services from climate hazards by looking at the changes in health data, the changes in the vulnerability to extreme weather events, all of that. So we talked about how to reduce emissions with regards to pharmaceutical care, looking at specifically to industrial pharmacy. We can think about supply chain management. We can think about the implementation of renewable energy, the reduced packaging, the looking at your manufacturing line and whether you have a continuous manufacturing line versus batch manufacturing. And there's more recommendations specifically in the policy. And then also in the policy, the environmental sustainability policy are items focused on adaptation, including a focus on extreme weather events. But for this topic in particular, we know that climate change does, as Chima mentioned, affect the prevalence and incidence of existing diseases like neglected tropical diseases and affect new diseases as well. And so our understanding of these trends can inform health promotion and can inform our education and can inform the preparation and the education of frontline staff as well as your patients as well. So it's important whatever topic you're in, like whatever specialty you're in, whether you're in community pharmacy, whether you're in hospital pharmacy, whether you're in industrial pharmacy, that you basically add a climate change lens to it. And none of us were experts from this from the beginning. Many of us just started in this area with regards to climate change, particularly over the last couple of years. So really, there is a lot out there now where you just type your profession and then you add the words climate change to understand how to better prepare yourself to the impacts to your profession with regards to climate specifically. So that's it for that particular question. I think that's it. Sorry, there were some more questions that just came in the chat, so I just wanted to just double check. Can individualistic medicine, so personalized medicine, be a solution for neglected tropical diseases? That's an interesting question. Or is it more kind of less personalized and more general? Christina and Chima.
I will say that the first approach to the diseases, they are like general medicines. So we use like paracetamol, and we try to keep patients with a good hydratation. But when the manifestation complicate or when they have severe forms of the disease, then we have to give personalized medicine. So even, for example, dengue also has hemorrhagic manifestations. So patients in many cases require like a blood transfusion and like a more personalized follow-up. So it depends of if there are non-severe forms, we can use like a general measures, but when we have severe forms, then it is necessary hospitalization and give a personalized follow-up for every patient.
Perfect. And Chima, anything to add there?
Basically, what I want to add here is basically that this disease prevalence, they present themselves with similar symptoms. So it kind of echoes the part whereby pharmacists have to be, engaged in public health surveillance in terms of understanding. Whenever you see people coming in with headache, constantly, everybody coming down with headache in a particular region, that's when you put on that public health surveillance cap. And like she mentioned, give those basic medication and not just sit back, but then watch how that turns out, whether they are presenting with complicated cases, and then, of course, you give your personalized treatment if the diagnosis has been confirmed.
Perfect. That's great. Thank you for that. I really like the diversity of expertise here, from all the way from like the beginning of public health, looking at the trends, research, all the way till your frontline work, which is really cool, along with climate. Really cool. So the last question I'm going to ask is, with expired medications, expired generic medications, how will this affect the climate, and are there any plans specifically for this? So I can basically answer part of this question. So yes, expired generic medications do have a consideration with regards to climate change. So if you think about medications and the medications' impact to emissions, the impact happens all the way from manufacturing all the way to use in certain medications, such as your inhalers and your anesthetic gases, and then all the way till waste, like till your incineration and from your transport to use to all the way till waste. So we want to try to prevent the amount of expired medications as much as possible. There's different types of work that is done and can be done at different levels for this. The first, all the way from manufacturing to understand how like what are the quantities of medications that are needed. The second, looking at expiry dates themselves and seeing if those dates are, from a data perspective, are those dates particularly accurate? Do we need to have more higher or lower dates, for example? And then the third, all the way till the frontline professional level, where you're looking at, how many medications are you ordering in? Are you ordering in too much or too little? And really looking into your inventory management, I think, is very important. And then finally, aside from climate specifically, there are wider implications to planetary health with regards to disposal of medications. So whether you focus on your incineration versus versus going to the landfill, for example, and advocating for changes in wastewater treatment, for example. These are all areas that are important to think about with regards to generics. Anything to add, Christina and Chima, before we go to our conclusion?
Yeah. So I think you've said most of it all, but I think that's also where our pharmacists have to take supply chains very seriously. Because if we consider supply chain very seriously, like you mentioned, from the manufacturing to waste, we tend to reduce the number of generic medicines that are wasted, because kind of manage knowing how quantity that we need and ensure these use adequate inventory practices to make sure that they don't get to waste. So that's one thing I want to add. And basically, I think, of course, advocacy for it, because especially in developing countries, they think about the wastage and how it's disposed of is also a big issue. In terms of incineration, burying it on the ground. I think advocacy in those areas is very important as pharmacists. So first of all, we don't ensure that they don't waste, and again, ensuring that we encourage safe practices in terms of its disposal.
Yeah, that's a really good point. In fact, I would say I'm not part of I'm part of the global north, not part of the global south. And one thing we do often have challenges with is donations. So like people are well-intentioned and they're saying, oh, I have some short-dated stock. I'd like to donate it to a country that will need it. But then they're donating and like that country doesn't need that particular medication, or the expiry dates are an issue, or there's language that's an issue. So really being very careful and looking at policy specific to donations, I think, going through reputable organizations, making sure that the people on the other end are actually like, this is going to be okay with regards to formulary, this is going to be okay with regards to expiry dates, this is going to be okay with regards to language. Usually with reputable organizations, they will give you some very solid information with regards to that. In fact, Pharmacists Without Borders, we don't even, for Canada, the PSF Canada doesn't even go into the donations aspect of things, and instead focuses on consultation and provides advice with regards to hospital pharmacy staff. So if anybody is interested in that, you can, we can put I'll put my email address in the chat. And if anyone is interested in that particularly, then, or in helping out with climate change related items relevant to pharmacy, please feel free to email, and then we can figure out how to manage things for the future. So at this time, I'd like to just default back to some FIP related areas. Ruben, I'm wondering if you can share the slides again, just to get to the last couple of slides. Okay, and then next slide. Okay, so at this time, we just want to mention that the 82nd FIP World Congress in Pharmacy is happening in Cape Town, South Africa, which is very exciting. Usually there are pharmacists there's a wide representation of pharmacists, including with various industries as well. So super exciting. It is going to happen from September 1st to September 4th. And there are opportunities to apply to have, oh, there we go. Okay. So the program topics include equitable quality healthcare, innovation, drug discovery and access, and of course, revolutionizing healthcare with AI. And the abstract submission deadline is the 15th of March, 2024. The results will come out by the 15th of April, 2024. And then there's an early bird registration deadline by the 31st of May, 2024. And there's more information about the Congress in that particular website as well. Cape Town 2024 FIP. And then there are also future FIP digital events, which you can access by going to events.fip.org. Thank you. Thanks for attending.